I love it. You guys are ready for this interview. Everybody, Josh Rubenstein, the director of media for Southern California, Kaiser Permanente. And I am joined right now by my good friend, Jamila Veasley, who is in our public affairs department in West Los Angeles, and Tonya R Barnett-Botshekan, who is a certified nurse midwife,
Correct.
right?
Yes.
They get everything right on all of that beginning there? Yes, no?
I think good enough.
Okay, there you go. So today we are talking about something that is absolutely lovely. Jamila, would you like to share with the world, where you're at right now?
Absolutely, and I think I can do better by showing.
But
yes.
I love the visual. I love the congratulations. You are pregnant. How far along are you? How far along?
Months.
6 months. Okay. How do you feel?
Today I feel good. Yeah, today's a good day. I was actually up all night with my soon-to-be 3-year-old, but I had some iced coffee, and I'm doing okay.
So you have a 3-year-old. How did the first pregnancy go?
Oh, it was amazing.
Yeah.
It was a dream. Literally no issues. Smooth sailing. Hey, I did it again, so it couldn't have been that bad, right?
There you go. That's right. It didn't scar you for life where you weren't going to do it again. That's good. Do you know what you're having? Or no,
surprise.
It's gonna be a surprise. See, now I'm a big there people go back and forth. Some people like a gender reveal, some people don't, some people want to know for certain purposes. I believe it's like one of the biggest surprises, and only times you get a big surprise like that. What's the feeling out there?
Well,
for you?
Here's the thing.
Yeah.
We know. Me and Latonya know what it is. We're just not sharing.
Everybody else is left out of it.
Yeah, I'm too type A for that. Yeah, I needed to know. I need to plan the nursery. I need to know, am I buying clothes? Am I not buying clothes? But it's a surprise for everyone else because we wanted some surprise around number 2.
Perfect. Okay. What, Latonya, do you see people who do like to know, don't like to know? Is it kind of 50-50?
Oh, no. It's about 95% of patients want to know what they're having. Yeah.
Really?
So it's the minority. But the best deliveries are the deliveries where the mother and the mom and the dad actually don't know. Because it is, like you said, it's a great surprise.
Yeah.
But 2022, about over 95% of patients want to know what they're having.
That's so interesting. What's funny is when my daughter was born, it was, we waited for the big surprise, and it was, I thought for sure it was going to be a boy the whole time, and, completely shocked.
Blown out of
Tell me what first of all, Latonya, I think you have such an interesting background. We were talking earlier. You grew up in Los Angeles, and you are working really in the same neighborhood where you grew up, right?
Absolutely. Born and raised in Inglewood, California, and in Kaiser, West Los Angeles for 31 years, for the last 10 years at the Inglewood Clinic. So literally, I look at the bus stop that I took going to high school every day. So it is definitely, I have come back full circle and totally enjoying the population that I serve here at Kaiser Inglewood.
I love that. I love that you are serving the community where you grew up. How important, and this is a question for both of you, but I'll ask you, Latonya, first. How important is it for people who grow up in communities to come back and work in those communities and serve their family, friends, neighbors, the people that they grew up with?
It's extremely important, especially when we talk about the disparities of healthcare. African American, unfortunately, sometimes don't fare so well when it comes to maternal child health issues. And so to be able to come back to my community, I know the issues in my community unlike no other. So I'm able to understand some of the challenges that our patients face and able to help circumvent some of the issues that can occur. I understand traffic. I understand my patients who don't have a car, who may be late for their appointment, not because they're late because of choice, but because the bus was late. I'm able to understand poverty and, not eating well. So instead of, really understanding that, oh my God, this patient gained this much weight, no, it's like, are you able to eat right? I'm able to understand all of the issues of the community that I serve. So I'm able to intervene earlier to help have good pregnancy outcomes.
Jamila, how about for you?
So I echo everything that Latonya said. I did not grow up in the city of Inglewood. I am a native Angelino, but I do currently live in Inglewood. And obviously I get my care with Latonya in Inglewood. And I couldn't think of any other way to get it, right? I think it's a weird thought to think to travel outside of your community to get care, right?
Yeah.
But unfortunately, that's a reality for a lot of people. So I consider it a luxury. And I think it's a luxury that everybody should have. But I'm super excited that I'm able to do it super easy, right down the street from my house.
Love that. And that brings us to kind of and I do want to get to in a little bit the concept of institutional racism and the ability to access healthcare, because that's a big component of that. But I want to get to your relationship, because Latonya is your midwife. And first of all, please educate me. A midwife, a doula, an OBGYN, give me the difference between everybody.
Okay, so OBGYN is a physician who's gone to medical school. A doula is a lay person that provides labor support for women. So many people believe that a doula delivers the baby, and the doula does not. The doula is there to give the support for the laboring mother to help her get through labor. And a midwife, there are two different types of midwives. There is a lay midwife who is not a nurse, so who does not have the nursing training, but is a person, a woman or man who delivers the baby, but outside of the hospital setting. And then you have a nurse midwife who is an actual nurse who has gone to school to get the midwifery training. We are master's prepared, doctorate prepared nurses who have the additional training to provide childbirth in and out of the hospital setting.
So you are going to be there for the childbirth. You are going to do that, correct?
So as Jamila said, her beautiful 3-year-old, I delivered her 3-year-old.
You did this already.
Amazing delivery, and we plan to repeat this again in about 3 or 4 months. Yes.
I love that. Why did you choose this career?
It's funny you asked that question. I was telling yesterday, I was in labor and delivery, and I had a physician come in, and she said that, looking at you, I should have gone back to midwifery school. Many people believe that midwives are people that flunked out of medical school. We did not. I believe that midwifery is an art. I'm not a junior doctor. And Jamila will tell you, I am a midwife to my soul. Midwife in itself means with woman. And our role is to be with that woman, to be the support, but not only be the support, to actually provide the care and the skill set to deliver the baby, but considering the mother, not the medical aspect. So physicians typically come from the medical aspect. Midwives come from the maternal aspect, from the woman aspect of supporting her, letting her know that her body is made to do this. Birth is natural. And so from the midwifery point of view, we come from that more natural with woman point of view, letting her know that her body can do this and providing her that natural support more than the medicinal way. So the end goal is delivering a baby, but the process, midwives and physicians sometimes come from different beliefs and styles of delivering the baby.
I assume that the process of delivering, first of all, I'm the dumb guy here who the dad really has no purpose for the first 6 months of anything, right? We just, we go out and buy diapers and change diapers and clean right. But the process of birthing, having that be a comfortable, loving, positive environment is critical, isn't
it? Absolutely. Just and letting that, just the confidence of knowing someone is listening to you, someone is hearing you, that what you want, just the comfortability of knowing that this person is here to support you, it makes all the difference. It really does.
Jamila, I want to say, why did you pick Latonya? And in that, I'd like other people, when they're watching this, to know what they should be looking for when they're picking someone to share this journey.
Okay. So, obviously Latonya and I have a very unique relationship. What people don't know is that we are actually neighbors. And so me and my husband, we purchased our home about 6 years ago, and like, it was literally, had no idea, opened the door. Wait, I know you guys, right? And I knew she was a midwife, but I was actually getting my OB-GYN care with another physician who I've had like as long as I can remember, probably like when I went to college at 18. But I obviously we already had another relationship, and I was like, yeah, we're looking to get pregnant soon, right? And she was like, well, that's awesome, that's great. Yeah, have babies. Let me know when you're ready. And so I was like, all right, didn't really think too much of it because we weren't in that mind frame yet. But when it came time, it was really a no-brainer. She looks like me, right? As a Black woman, it's super, super important for me to have someone providing my care who looks like me, who knows what I go through on a day-to-day basis, someone who can relate to me on all levels. So I think that was primary for me. But then I really liked the midwife aspect, right? I think it's something, and I don't know if this is just more predominant in the Black communities. You have a specific perspective of a midwife, you know, that dates way back, right? As to something that was like a little bit more nurturing, you might think of, than just a traditional, you know, physician hospital birth. And so that was appealing to me. It was unique in that sense. And then just her personality, we're super relatable. She's super open, very direct. And I think especially when you're going into something like childbirth, you want someone, in my opinion, who's straightforward, who's direct, right? Don't beat around the bush. Don't say things I'm not going to understand. I need to be able to have an open relationship with you so I can voice my concerns and you can, you know, set me straight or tell me things that I don't know and need to know. So all those things really married together, and it was just hands down, she was the only person that I was going to choose.
That's really interesting. And I love the fact that you're neighbors. What's really interesting about this story is it kind of goes back to what the midwife was before there were big hospitals in big cities, right? That this is what it's a village, right? And it takes a village to raise a child, as you know.
Yeah, historically, midwives were just women in the community. They weren't trained educationally. You know, historically, Black women couldn't go to midwifery school. They were trained by the midwife. The midwife trained a midwife, trained a midwife, and it was community. And it's providing that holistic care for Jamila living across the street when she's outside with her 2-year-old and I see her looking tired. I'm like, what's going on? You look really, really tired. Are you fatigued? What's going on? You know, I'm able to provide care for her, not just in my office 20 minutes every month. I provide her, it's community. I provide care to her when I see her in the morning, when I look down and I'm like, oh, your feet are swollen. Go in there and put those feet up. What did you eat? What did you eat? What did you eat for lunch yesterday? Jamila loves tacos. It's like, how many tacos did you eat last night? Because I see these feet. You know, this is community, and it is a type of care that if I see something, we don't wait until her appointment on April 24th. I'm giving care to her community oriented, in the grocery store, down the street, at church on Sunday. I'm seeing her and providing care for her always. And that's what midwifery traditionally is all about.
And the fact that Kaiser Permanente has incorporated midwives into our care, that's somewhat unique, right? For a big healthcare
Kaiser
system.
is, some of the bigger hospitals have midwives, but they don't function the way KP allows us to. I have my own patients that for 30, I have been seeing some of the same patients literally for my 31 years that I have been in Kaiser. I've actually, to date, that I know of, I have actually delivered 19 babies that I delivered. You can't, I mean, that's just awesome in and of itself. And it is KP that allows us to do that, that provides the full service nurse midwifery care where we are providing clinical care in the clinic, but I'm also able to provide that inpatient care to actually do the delivery. And that's special to KP.
And
I want to
go
kind of
ahead,
jump in on
please.
that. Sorry, that was actually super important for me too, right? Because like I'm not birthing babies my entire life, right? It's just a short period of time for me. And so I was like, wait, Latonya, when I'm done having babies, I can stay with you, right? I can still continue to get my care with you, right? Or is it just midwife, literally, do you just, help me through
I
my
never did
birthing years? But so the fact that I get to keep her on, and then she actually knows that part of my life as well to integrate into my future care is also amazing.
I want to share with you that when I was preparing for this, a statistic that I found incredibly troubling. And I want to get your thoughts, both of you, on this. Black women are 3 times more likely to die from a pregnancy-related cause than white women.
Yes.
This is a real issue. Please tell me I think I want to hear from Jamila first as the pregnant woman here. What are your thoughts?
Yeah. It's scary, man. It's super scary, right? I'm not someone who worries a lot, right? And this being my second pregnancy, I think I'm a little bit more at ease, but it's still scary, right? And I think especially the first time around, anything that happened. Oh, I tripped. Tonya, is the baby okay? Because it's pregnancy related, right?
Mm-hmm.
It'd be different. It'd be even different if it said like if the stat was related to actual birth, labor, right? Because then it would narrow it down. But it's pregnancy related, so there's 10 months where I have a higher chance of dying than my white counterpart, and that's scary, especially for a first time mom. So it's something that you think about all the time. And there's nothing you can really do about it. Yeah. It's just a stat and it's true. So, I try to, anything you worry about, you just try to arm yourself with education, anything you can do or get to increase your chances of bettering yourself. Right. And so arming myself is Latonya on my side.
Yeah.
Right. I feel like that's the biggest thing I could ever do for myself and my family, is to have someone who I fully trust, and who I know has my best interest, who I know is going to take every seemingly little thing serious, and understands that when I walk through that door, I am a walking stat. Right. And it keeps that at the forefront of her mind. It's not just something that's just, oh yeah, that's in the background. No, that's reality. And so it's not just me who's thinking about that, and knowing that I have someone like that on my team really kind of calms things. But I think this second pregnancy, like I said, it's not at the forefront of my mind, but it's still there.
And the contributing causes: quality healthcare, chronic conditions, structural racism, implicit bias. Latonya, is that something that you've seen in your 30 years?
It is definitely something that I have seen. If you ask any of my colleagues, they will say Latonya is the big mouth. Latonya's not the big mouth. Latonya's the advocate. When I started at KP 31 years ago, I was the only woman of color in the department. And there was one over. There were 2 of us, and I fought. And I fought not for personal issues. I fought for my patients, and I saw where one person, would walk in the door and get certain privileges, but when someone looked like me walked in the door, they didn't get those certain privileges. For example, being taken off work or, just saying simply that they have pain. The caveat to the stat that you just stated, Josh, is not only Black women died, it's Black women of all educational backgrounds. So you can have a Black
Mhm.
woman with a PhD, with an MD, is still, they still, the white women of lesser educations still have better outcomes. White women with no health insurance have better outcomes. When you look at people like Beyonce and Serena Williams, who are millionaires, who are having poor pregnancy outcomes simply because Black women aren't listened to. Their pain, they're not believed to
Mhm.
have pain. So when you have women like Serena Williams saying, I'm having pain, and doctors are not listening to her, and then we end up with terrible outcomes, we have to change those things. And so that's when when you say 3 to 5 women, people put in their mind, oh, well, those are poor women and those are women that, have
Mhm.
diabetes and high blood pressure. No, these are women with PhDs and women with MDs and women with means beyond means that are still having horrible, horrible outcomes simply because of, intrinsic bias and just simply not being listened to and not being believed. And when you have a provider that looks like you, I am more apt to hear that person. I believe that Black women have pain. I believe that Black women, when she says, I'm short of breath. I believe a Black woman when she simply tells me, I'm afraid, because fear is usually brought on by some mechanical aspect of the body that's causing you to fear that way. I'm going to believe that and now start looking to make sure we take care of you and we're going to get you through. And that's the one thing with Jamila. Jamila knows I am her advocate. I'm going to fight for her. I have fought for her. And there's nothing that I'm not going to do to make sure that baby number 2 gets here safely.
And what you're saying is a system that has decades upon decades of this muscle memory of not listening and not recognizing and not believing. Um, that's a tough fight. But do you see us making
I
inroads?
think in the last years, when you have unfortunately, as you're having your high profile patients now saying, this is what happened to me. When you have
Mhm.
a television judge, her daughter just died in childbirth, and, now you have the outcry of, we complained of A, B, C, D, and you're seeing that African women simply aren't listened to. When you see the unnecessary deaths that are happening because vital signs are not, maybe it's like, oh, Black women have high blood pressure. So if their blood pressure is high, you don't really pay attention to it as much because white women, they really don't have high blood pressure. So if their blood pressure goes high, we're going to pay attention to that. But
Mm.
Black women have high blood pressure. It's okay. When you have to realize that you have to treat everyone the same every time. You can't have a belief of what you think a white woman does versus a Black woman. If you just treat every person the same every time, every person's complaint is listened to and validated, that's when we'll get to the point. Equal listening, equal care, equal outcomes.
What should a Black woman who's pregnant right now, how can they advocate for themselves if this is happening?
Yeah.
If
Let me take notes.
yeah, I mean, if you're in a situation where you don't have
Yeah.
access to a Black midwife, or you don't have access to someone who looks like you, or who has the same experience as you, what can a woman do to ensure that
What
they're
I
being
tell
heard?
my patients, even when I tell my patients, if I'm going on vacation and I know that I'm going to book them back with someone else, or if I have friends that are not seen in the Kaiser Permanente system and they tell me who they're seeing, I tell my patients, write your questions down and do not leave that exam room until every single question is answered. And if your questions are not answered, ask to speak to a supervisor. What ends up happening as African Americans, we have lost our voice because our voice is heard as angry. Our voices are often heard as intimidating. So, in an effort to not be angry or intimidating, we're silenced. And so we want to go into an exam room, and we don't want to ask the questions, and we want to be seen as, we're not threatening. And so you quiet your voice, and a lot of times, in a lot of instances, we've lost our voice. We have to get our voice back. And when someone is not listening, you have to say, I'm sorry. You're grabbing the door of the exam room, but I still have 4 questions to ask. And I tell my patients, literally, that's what I want you to say. I still have questions. I did not get all of my questions answered. And if you can't answer them, then maybe you can get a supervisor in here that can get someone on the phone. But do not leave that exam room until your questions are answered. And do not be afraid to ask for that second opinion. We often don't want to make trouble or don't want to be seen as troublemakers, so we won't ask for a second opinion because you feel like you're questioning the doctor. Well, you have a right to question the doctor. It's your body, it's your health, it's your life. You only get one. So I tell my patients, slow that provider down and make sure not only do you ask the questions, but you get the answers that you're satisfied with.
I love that. I love that. And I think that that's what you're saying is important, is critically important for a Black woman. I think it's critically important for any patient that comes in, right? Anybody that, we're so in a zone where everybody's fast moving, and they want to move on to the next thing, but getting the care and being heard is so important. And I think in every corner of the world, people are not being heard. Jamila, what advice would you give to a pregnant woman now who just got pregnant? You got one down, you're on the road now with number 2. What kind of advice do you have?
I would say maybe 2 things. Enjoy it, right? There's so many things that come out of a woman who's pregnant that can either steal that joy or dampen that joy, like the stat that you read earlier, right?
I don't mean to dampen joy, by the way.
No, it's okay. But I'm just saying these things exist, right? But we have to remember that it really is a beautiful time. I hate to sound so cliche, but it's a beautiful time, and it's such a small period of time that you want to enjoy it to the fullest. Even if, unfortunately, you might have some complications, just work through them and focus on the good, cherish each one of those little flutters, those kicks, those hiccups, all of it, even though some of it's painful, cherish it. But, and then also, not to echo Latonya again, but speak up. I am also someone with a very loud voice. I'm not one to necessarily silence myself, but I do know I have silenced myself in the healthcare setting because maybe not because of the color of my skin, but because I felt inferior for whatever reason. It might have been, I'm not as smart as the person in front of me, whether it's a doctor or a nurse, whomever, right? But when it comes to pregnancy, and I think it might just be a reaction because of Latonya, she's my provider, that I speak up. Anything, I'm going to speak up. I'm going to say something to her. I'm going to, even if it's just off the wall question, is it supposed to hurt like this? Is it okay if I put an ice pack to get them to move? Just random things. But
is that a thing? Can you do that? Can you put an ice pack on it?
She told me to. Yes, it is. And it works. Anyway, but you have to speak up. And even outside of just like the healthcare setting, you know what I mean? Ask for help when you need it. Tell your partner you're off duty for dinner. Take a load off. This is 10 months that you really get. And again, to help you enjoy it, speak up, take that load off, and just try to
And
really
one
enjoy that
thing, I'm
time.
sorry, and
You
just to
two,
one thing to
go
piggyback,
ahead. No,
one of
please.
the things, Jamila is right. She's educated. She knows. She's very articulate. But in the healthcare system, you feel intimidated because you are seeing Dr. X. And Jamila will tell you one of the things. None of my patients call me nurse this, nurse midwife this. Every single one of my patients calls me Latonya because that lowering of the hierarchy. When people, my patients, Josh, my patients tell me some stuff, but they tell it to me because they're comfortable, and I make everybody comfortable. And I know husbands and kids, and I on the ultrasound, Jamila, what do I call all my babies on the ultrasound? What do I call Callie?
I forget.
All my babies are my stinky
Stinky
butts,
bad.
or like I make nicknames. And when you have your patients feel comfortable, Jamila knows that there is nothing that she cannot ask me that I'm not going to
Yeah.
answer. And just that level of confidence, that comfortability, just calling me by my first name, those are such small things. But a
Mm-hmm.
patient that knows she can walk in the room and say, "Hey, Latanya, how you doing?" Or some of my just, "Hey, girl," but that doesn't bother me
Mm-hmm.
because
That's me.
when I respect my patients respect me. I don't get respect from my patients by calling me doctor, whatever. That's not respect. Respect is knowing and having the confidence that I am going to take care of you, that you're going to get the best care, and that you can
Mm-hmm.
ask anything. And I think respect is viewed so that it's so skewed. Just by saying doctor such and such, that's not respect. I think we need to work on lowering the hierarchy in healthcare so that patients are comfortable enough to ask us the real questions, the questions that matter, and the questions that they're fearful of, fear to being judged or thought of in an untoward way, and they're not getting the answers or the care that they need and deserve.
You are amazing, Latanya. You
Come
make
on,
me want to be
Josh.
pregnant.
Come
I
on.
mean, you're fantastic, and we are so fortunate to have had you for the 3 decades that we've had you, and you are making KP a much
Thank
better
you.
place as we move forward. And
Mm-hmm.
thank you so much. And Jamila, thank you for sharing your story.
Yeah.
Wishing you not, and thank you for your voice, and thank you for this important conversation. Wishing you nothing but healthy and easy times moving forward
Thank
here
you.
through the rest of this, and you and your family. Thank you so
Thank you
much,
so
both of you. You're
much. It
both
has been
lovely.
our pleasure.